To protect lives and livelihoods, a slow, steady lifting of lockdowns is key to both stimulating economies while also keeping a vigilant eye on the virus so that control measures can be quickly implemented if an upswing in cases is identified. Over the weekend, we saw signs of the challenges that may lie ahead. In the Republic of Korea, bars and clubs were shut as a confirmed case led to many contacts being traced. In Wuhan, China, the first cluster of cases since their lockdown was lifted was identified. Germany has also reported an increase in cases since an easing of restrictions. Fortunately, all three countries have systems in place to detect and respond to a resurgence in cases.
If disease persists in countries at a low level without the capacity to investigate clusters, identify clusters, then there is always the risk that the disease will take off again. I think now we're seeing some hope as many countries exit these so-called lockdowns, and this is good. It allows economic life to return. But extreme vigilance is required, and not just vigilance. Many countries, as the DG has said, have made very systematic investments in building up their public health capacities during the lockdowns. Others have not. So we hope, and we have faith, that Germany, Korea and other countries will be able to suppress the clusters they're having, and in some cases, and maybe at a subnational level, they may have to impose some specific measures that are targeted at reducing particular types of transmission. It's really important that we hold up examples of countries who are willing to open their eyes and willing to keep their eyes open. Shutting your eyes and trying to drive through this blind is about as silly an equation as I've seen. And I'm really concerned that certain countries are setting themselves up for some seriously blind driving over the next few months.